My name is Marisa Ashley, developmental psychology at Gulf Coast State College under Mr. Hudson. I did my video project on the different aspects of working with different aged people in physical therapy, specifically first choice physical therapy on the beach. I interviewed 2 physical therapists, DPTs, and John Gremlin and Brian Bower. I learned many different things from interviewing these 2 physical therapists, and their interviews are here along with what I have learned at the end.
What is your name?
My name is Johnny Graham, physical therapist at First Choice Physical Therapy.
Okay, how long have you been practicing physical therapy?
About 3.5 years now.
Within those years, have you had one specific patient type or generalized ages?
It's a specific patient type, yes. We treat mainly orthopedic patients, so patients that have had some type of orthopedic surgery or orthopedic injury. And then ages probably from maybe about age 8 to as old as you can get. I've had 80, 90-year-olds.
Keeping development of cognitive and physical functions in mind, is there a certain way you go about helping the patients of different ages?
Yeah, with your younger population, so folks like yourself, you're going to be trying to push them to get back to higher level activities such as sport, track, cross country, swimming, baseball, basketball. Whereas some of your older population, maybe your 70-year-olds, you're going to treat them with trying to basically maintain where they are and give them more longevity and promoting more wellness rather than high intensity physical activity like you would the younger population.
Do the same accommodations apply to patients with young healthy bones versus patients with older brittle bones?
Sometimes. So the only time you really consider accommodations like that for older brittle bones, like you mentioned, is specifically 2 conditions. One is osteoarthritis, and the other is osteoporosis. Osteoporosis is where the bone density is affected, so you have a higher chance of fracturing and that sort of thing. And you're going to see that in an older population, mostly women. And then osteoarthritis you can see really at any age, but it usually occurs around middle to late stages in life. And that osteoarthritis is going to be an arthritic component or an erosive component to the joint. So you do have to make kind of special accommodations for those type of patients as compared to somebody much younger with neither one of those conditions. You can kind of go on as normal.
What about the accommodations in correlation to the cause of the injury, so sports-related, car accident, or just wear and tear of body?
That's a good question, actually. Oftentimes after a surgery or something like a car accident, which would be considered trauma, you may have weight-bearing precautions in place. For example, let's say you break a bone in your lower leg, and that surgeon puts in plates and screws and rods or whatever they deem necessary. You may be placed on weight-bearing precautions to allow that healing to occur for the bone. And then those precautions may be in place for 6 to 8 weeks, 10 weeks, whatever the case is. So that would be an example of you having to accommodate for that type of structure. In contrast to that, let's say that it's not a bone injury, it's a ligament injury, and you've had some type of ligament reconstruction, whether it be a graft or a tendon or whatever that they use. They have to allow for a healing to occur just like the bone. And so you may have to limit different stresses or different movements to that particular part of the body for X amount of time to allow that healing to occur as well. And then if you try to tie that all in together, if you bring in the aspects that we just talked about a minute ago, osteoarthritis or osteoporosis, you can tack on an even longer time frame for that weight-bearing precaution or that protective phase to be in place, because it can be expanded if there's any underlying conditions going on that prevent the healing process from occurring normally.
Okay, that's it.
Perfect.
Thank you.
Yes, ma'am. Thank you.
Hi,
What is your name?
my name is Ryan Bowen.
How long have you been practicing physical therapy?
For about 3 years now. 2.5, 3 years.
Within those years, what would you say is the majority of age groups you work with?
So I started off working at the hospital, where we saw pretty wide variety, but mainly adults and up to 90 some years old. And then I started working at First Choice about a year ago, and that has been also a wide variety, all the way from about 6 years old to 90 some years old again. So.
Is there a certain age group that's easier to help with than others?
So you kind of got to treat them a little bit differently. With kids, you got to make it more like a game, it seems like sometimes, to get them interested. And then I'd say probably the easiest one is just adults, because you can just kind of tell them what to do and they'll do it. Whereas with kids, they might not be as interested if you just tell them to do 3 sets of 10 on something, or but older patients, they kind of require a little bit more cueing sometimes to maintain proper form and everything with that as well. So probably adults would be the easiest ones.
Does the development of cognitive and physical functions in a patient help you when it comes to aiding them?
Yeah, so like with the older patients, like I was saying, sometimes they might have just a harder time understanding the exercise or how to do it or whatever. So just to maintain form or just how to do an exercise, it requires a little bit more cueing for them. Same with kids, it's going to be, they don't really understand exactly why you're doing the exercise too necessarily. So like I was saying before, it's more, you got to have fun with them kind of to keep them interested in it.
What's one thing you have learned from working with patients of various age groups?
Let's see. One thing that I've learned, older patients, I guess just being nice to them, they kind of respond pretty well to that. It seems like most of the time you respect them and they usually respect you as well. So
Symbiotic.
yeah.
Does the age of the patient correlate with the care they receive?
So obviously you want to treat everybody, with the same amount of respect and everything, but just how you are going about it is going to be a little bit different than how I mentioned before. But yeah, I guess you want to respect everybody kind of evenly.
Describe one pro and con with working with more able-bodied patients versus patients whose bodies are breaking down.
Okay, so the able-bodied stuff, you can do more higher level activities that's kind of fun to mix up instead of just the boring routine that you do sometimes with other patients. We have some athletes and stuff that we'll play catch with or something while they're standing on one leg or something like that. And then a con of that, I don't know if it's necessarily a con, but you have to think a little bit harder. It's a little bit more challenging as a PT coming up with certain exercises for them.
To make it more interesting for them?
Yeah, for sure. And then on the other end of the spectrum, I would say a pro would be, it's pretty simple. Just usually it's just trying to strengthen a certain muscle group or getting them back to function as best you can. So it's simple in that sense. And then a con would just be that it's kind of the same thing. It's just kind of boring though, is the only problem with that. So.
Okay, that is it.
That's
Thank you
it?
very
All right,
much.
sounds good.
Really shake your hand, but
Yeah, go ahead.
Based on the 2 interviews I conducted, I found both physical therapists work with a wide variety of ages perfect for this project. When it comes to helping younger patients, they take advantage of the able body they possess. They push these young patients more due to the fact they are more strong than others. The main goal they have with these younger patients is to get them back up and going new again. where they have a long life ahead of them, where the body would naturally break down anyway, and they do not need past injuries speeding up the process. When it comes to helping more elderly patients, they still push them, but they integrate mini breaks into a session. These folks also get more stretching out and rubbing out because they cannot receive the benefit from doing it on their own. The main goal for the elderly patients is to get them back up to just walking or lifting a pen again, with no pain. As we age, our bodies do wear down and functions begin to work either minimally or not at all. Here, the therapists try their best to not make them bedridden for the remaining years of their life. They make them feel young again, in a way. Older patients may also have some difficulty performing the mini workouts if they have experienced a medical condition such as osteoporosis or osteoarthritis. They just have to be more careful and gentle when handling aid to these age group. Weight-bearing precautions are also present more in the older population, especially women. However, surgeries performed in a body of any age will need certain accommodations. With surgeries in general, though, they are careful not to go in too strong with too much force. It is a gradual increase rather than a full force. That being said, both doctors did affirm younger patients have a higher pain tolerance than older ones. This again goes hand in hand with the body, the physical functions. Younger patients typically play sports, so they have knowledge of what it is like to be out of their comfort zone. Older patients, however, have already surpassed this point in their life and are just trying to go about their day. On the more cognitive end of the spectrum, kids need to have their therapy in more of a game complex so they don't get bored. They don't really understand what they're doing there. All they know is that they are in pain. Adults are the easiest age group though, because they fully understand the exercise, can do 3 sets of 10 easily, and then be left alone to work. Elderly patients, however, may not understand how to do the exercise. The young and old population just have to stay focused and learn how to do the exercises with just a little more help and one-on-one time with the therapists. All in all, they just want their patients to have a fun time while getting going again. Respect is key when it comes to this line of work. Everyone is equal here when it comes to kindness and respectfulness. Strengthening the body for patients of all ages is what all physical therapists all over the world hope for. Their motto at First Choice is keep calm and get better. And that is 100% true. Just stay calm, and with the help you receive, you'll be back in the top in no time. Thank you.